Thank you for joining me today. In this video, we are going to learn more about mental health disorder prevention and mental health improvement, mental health promotion and disease prevention. Please join me and subscribe the channel. Thank you. So mental health promotion and disease prevention are the fundamental component of mental health care. Rather than focusing on solely diagnosis and treatment, clinicians aim to enhance psychiatric well-being, improve resiliency, reduce risk factors, prevent the progression of this mental health disorder. Effective prevention integrates biological, psychological, social, cultural, and environmental determinant of health across the lifespan. By implementing evidence-based prevention interventions, clinicians improve quality of life, decrease psychomorbidity, reduce health care costs, and create healthier community. World Health Organization defines mental health as a state of being in which an individual recognizes their ability, cope effectively with normal life stress, work productively, and contribute to their community. Mental health promotion focuses on increase protective factors that foster emotional, psychological, and social well-being, while reducing exposure to conditions that increase vulnerability to psychiatric disorders. Healthy promotion seeks to optimize functional even among individuals who do not have the diagnosis illness. It emphasizes wellness, resiliency, emotional intelligence, healthy coping strategy, supportive relationship across the community resources. So if you want to improve your well-being, mental well-being, if you want to improve your health mentally, you want to improve your well-being, you want to improve your resiliency, coping skills, emotional intelligence, healthy coping strategies. That's what you want to learn and adapt. Healthy coping strategies. And you want to seek for supportive relationship and access to community resources. Disease prevention encompasses an intervention is designed to reduce the incidence of mental illness, lowers the prevalence, recurrency, and disability associated with mental disorders. Preventive psychiatric aims to identify individuals at the increased risk before the development of a clinical significant symptoms. So if the person is alcoholic or drug use or vulnerable to mental illness risks, disease prevention, mental health disease prevention will help that person develop before they develop symptoms. Intervene early, encounter to all disease trajectory. They wanted intervene before the patient or the person develop mental illness. Preventive effort target both individual and population through a screening, education, lifestyle changes, early treatment, and relapse prevention. The goal of mental health promotion primarily include promote psychological well-being, improve resiliency and stress tolerance, reduce psychiatric morbidity, prevent homicidal or suicidal or abuse, enhance social function, and improve quality of life, reduce stigma toward mental illness, increase early recognition of psychiatric symptoms, improve access to mental health services, strengthen family and community support system, promote recovery-oriented care, reduce health disparity among vulnerable populations. Level of prevention. There's a primary prevention. Primary prevention occurs before the mental health develop and aim to reduce the risks while improving the protective factors. So prevent the mental illness and improve the strength protective factors. The goal of primary prevention is prevent new diagnosis, psychiatric diagnosis, promote healthy development, improve coping skills, increase resiliency, and reduce exposure to adversary experience. Examples of primary prevention include parent education, school-based emotional learning programs, bullying prevention, suicidal awareness education, workplace stress, substance misuse prevention, community violence prevention, perinatal and postpartum mental health education, sleep hygiene education, physical activity, exercise, and healthy eating promotion. Secondary prevention emphasize the early identification and promote treatment to reduce the symptoms, severity, and prevent the progression of the mental illness. The goal of secondary prevention is detect illness earlier, improve treatment outcomes, prevent hospitalization, reduce disability. Examples of secondary prevention include depression screening, anxiety screening, SI risk assessment, screening for substance use disorder, early psychiatric interventions, ADH screening in the children, cognitive screening in older adults. If you want to screen them if they have Alzheimer, dementia, perinatal depression screening, PTSD screening and follow up from trauma events. If you know this person had a traumatic event, you want to screen for PTSD. Tertiary prevention mental health. Tertiary prevention for mental health aims to minimize the disability. Let's say the patient have bipolar disorder or schizophrenia. You want to minimize the disability that disease or mental illness can cause to the patient. You want to improve their recovery. You want to prevent relapse after psychiatric disorder has been already diagnosed. And the goal of tertiary prevention is prevent relapse. You don't want them to relapse and come back to where they were and come back to the hospital. So you want to set up prevention strategies, prevent relapse strategies. You want to improve the functional recovery for the patient. You want to reduce the complications of the disease and medication. You want to enhance the quality of life of the patient. You want to promote community reintegration. You want to help them to go back to their school if they can, go work, have a stable house. If they cannot do themselves, you will help them to have somebody support them, help them to integrate in the community, do the daily activity of life. Example of tertiary prevention of mental health include medication management, psychotherapy, assertive community treatment, supportive employment, social skill training, family therapy and family education, relapse prevention plan, long-term follow-up appointments, peer support. Protective factors reduce the likelihood of developing mental illness and improve recovery. Individual factors include positive self-esteem, that is the protective factor. Preventive factors for individuals include positive low self-esteem, positive self-esteem, that is the protective factors. Emotional regulation, you want to help them to have that. You want to help them to have positive low self-esteem, regulate their emotion, healthy coping strategy. You want to teach them that. Optimize, you want them to have good physical health, eat well, exercise, sleep, adequate sleep, regular exercise, spiritual well-being. And the family, you want to support them, secure attachment. You want to teach them or help them to develop secure attachment, stable home environment, positive parenting, family communication, improved family communication, emotional support, financial stability, and community factors. Safe neighborhood, include safe neighborhood, strong schools, access to health care, employment opportunity, social connections, cultural inclusion, and community engagement. Risk factors for mental illness include biological risk factors, psychological risk factors, social risk factors. So biological risk factors include family of mental disorder. So if the family have mental disorder, that can lead to, that is one of the biological risk factors. Genetic susceptibility, chronic mental illness, trauma or brain injury can lead to mental illness. Family history can lead to mental illness. Genetic susceptibility can lead to mental illness. Neurodevelopmental disorder can lead to mental illness. Hormonal changes can lead to mental illness. Substance usage can lead to mental illness. And psychiatric factors that lead to mental illness include childhood trauma, adverse childhood experience. Poor coping skills can lead to mental illness. Chronic stress can cause you to develop mental illness. Low self-esteem can cause you to have mental illness. Personality vulnerability. Personal vulnerability can lead to mental illness. Social factors that lead to mental illness or cause mental illness that makes the person be vulnerable to psychiatric disorder include poverty, homelessness, social isolation causes mental illness. Discrimination also causes mental illness. Unemployment causes mental illness. Domestic violence also leads to mental illness. Community violence also leads to mental illness. And limited access to health because there's no prevention. So imagine somebody is poor, homeless, have a social isolation, going through discrimination by being poor, homeless, maybe their culture, maybe their color. They are going through discrimination or stigma, being homeless and poor. And then they are unemployed because they are already poor and homeless and isolating themselves from the society. And maybe they had a domestic violence, community violence, and they have limited access to health care. So that person will definitely have mental illness, because all these risk factors, if they deal with one, it's hard to deal all these factors. So all these are social factors that leads to mental illness. Healthy promotion across the lifespan in the children and infants. How are you going to improve their health? You want to help them to develop secure attachment. You want to teach the family what secure attachment is, positive parenting, so education for the parents, develop mental health surveillance. So you want to screen them if the child or infant have mental illness. You want to educate the parents who are taking care of the child. Early intervention service if you think they are risky to developing mental illness. As we talked about all this risk, you will screen all these risk factors, and then you want to begin early prevention services. You want to encourage school readiness for the child so they can emotionally be ready to attend school from outside the house. Emotional intelligence. You want to also bullying prevention. For teenagers, you want to screen and prevent SI and homicidal, substance use prevention, digital media safety. You want to teach them that. You want to teach them the risk of the substance abuse. What are the risks? Healthy relationship. You want to teach them healthy relationship. Stress management. How they can how can they manage their stress? Skills to manage their stress. Depression screening and anxiety screening. So education, teaching, training, talking to them about the risks that risk the bully or depression, isolation, substance usage. You want to teach them the risks and the benefit of having a connection with the society, with family, having a supportive parents, how they can communicate their needs. You want to teach them, screen them from any mental illness, and provide them support and resources. For adults, workplace wellness, stress reduction, physical activity, exercise, sleep hygiene, substance misuse prevention. You want to counsel them, relationship counseling, manage of a chronic illness. Those are for adults who are working age. For seniors, you want to screen for dementia, depression, social engagement, fall prevention, caregiver support, manage of a chronic illness, and prevention of a isolation. Prevention and promotion of a mental health. You want to perform comprehensive biopsychosocial assessment, screen for mental health and substance disorder. You want to educate, psychoeducation, healthy lifestyle behavior, psychotherapy interventions, prescribe and monitor medication, coordinate interdisciplinary care, advocate for equal access to mental services, support family and caregivers, reduce stigma, mental illness stigma through education. You want to evaluate the treatment outcome, mental health promotion strategy include routine mental health screening, collaborative care that integrates healthy behavior, cognitive healthy behavior therapy, mindfulness to reduce stress, school-based social emotional learning programs, workplace mental wellness initiative, early intervention service for psychosis or first episode of psychosis, family education for serious mental illness, smoke cessation and substance interventions, sleep optimization programs, crisis plan and safety plan for individuals risky to themselves or to others. Prevention is a continuous process. Routine screening for depression, anxiety, substance usage, trauma exposure, HI&SI, early detection, and timely interventions can prevent mental illness. You want to address social determinants of health such as housing, food insecurity, education, employment, access to care, recovery. You want to encourage recovery-oriented care by emphasizing the patient shared decision making, improve resiliency, functional recovery, symptom relief, promote healthy promotion is most effective when combined education, evidence-based practice, family involvement, community collaboration with community resources. Thank you for joining me today. Please subscribe and join me again. Thank you.